So in the clip all the way on the left, you'll see that the movement is initiated from the forearm, okay? And the actual arm bone here, the humerus and the shoulder blade, the scapula, aren't really doing much. So it's a primarily forearm-driven movement, but it appears like we're getting rotation because you see the hand and the wrist change. Now, when you look at the middle video, you're going to see that the movement is actually driven from the humerus here. So the humerus is spinning in the socket and it is just carrying the forearm with it. So they're moving at the same time in a nice long line together, okay? And then when you look at the last video, you're gonna see that it's primarily scapular movement, meaning the shoulder blade is driving the movement and that shoulder blade is carrying the rest of the arm with it. So it's good to be able to separate these out and show on people so that they can feel actually the difference in what does isolated forearm rotation feel like? What does isolated humeral rotation feel like? What does isolated scapular rotation feel like? Can we separate them out? And then can we integrate them back together? So in this video, you'll see that I'm integrating them. Okay, so I'm getting some spiraling where the forearm starts, then the humerus, then the scapula, okay? And then we rotate it back the opposite way, forearm, humerus, scapula. So you get sort of a sequence happening where you can start to coordinate them as a full rotational unit of the whole upper extremity. Now, why is this important? Okay, it's important because often we'll test something like the rotator cuff, okay, of the shoulder, and it will test strong, but it's not actually strong because sometimes people are faking it by either using their shoulder blade to push against that movement, or they're faking it by using their wrist and their forearm, okay? And that's a lot of time when you're doing banded exercises with somebody or something with weight, and they're like, oh, my elbow's feeling it. It's like, well, that's because you're using your forearm instead of your shoulder, okay? Or they feel it more in like their upper trap or their kind of shoulder blade area gets real tight, okay? Because they're not using their rotator cuff, okay? They're using their upper back and their neck, okay? So it's really important to be able to kind of separate these things out so you can tell where the deficits are so you can start to build them back up with people.
If this is external rotation of my shoulder, okay, and I'm doing a band or I'm testing against the PT's resistance, whatever, what happens if I retract my scapula? Watch this. What does it look like I'm doing? Do I end up in the same exact angle and position that a PT would test me? I'm going to retract my scapula.
Okay, so you're saying that she's using the scapular retraction instead of the humeral rotation?
To rotate her humerus, correct. To make it look like she's externally rotating. So they're testing her. And they're going, she's like, yeah, my doctor tested me. I do great. She's out here. They test her. She's fine because guess what she's using?
Wrong one.
All back in here.